Welcome back. The Competition Commission of South Africa has dropped its price-fixing case against Johnson & Johnson. The investigation was launched in September last year against J&J and its subsidiary, Janssen, for their inflation of the life-saving TB drug, Bedaquiline, I think is the pronunciation. The companies have since dropped the drug's price in South Africa by about 40%, from 5,500 Rand to just over 3,000 Rand. The company has also agreed to not enforce the patent for Bedaquiline, allowing for generics by companies in South Africa. So let's unpack the story now and bring in the head of communication at the Competition Commission, Sipho Ngwema, as well as the founder of the Health Justice Initiative of South Africa, Fatima Hassan. To both of our guests, thanks very much indeed for joining us this afternoon. And Sipho, I want to begin with you, because the question is, do you just drop the case against Johnson & Johnson and Janssen because they've now decided to drop its price, or should there be further sanction?
Good afternoon. Thanks once again for having us on your program. What we have done after receiving the complaint, of course, we initiated an investigation, and there was a lot of interaction and quite extensive interaction between us and the company. And you must remember, what had happened so far is an application for a secondary patent, meaning that that process had not kicked in yet. And of course, that meant that then you can now have more generics, and then the drug can be much more available cheaply to the Department of Health, which is the procurer. So we do these investigations for a number of reasons, but some of them are, one, to make sure that the conditions are conducive for the consumer to be able to shop and buy and get better prices, but also to make sure that the drug is, or whatever investigation, that particular item is available. And in this, in terms of public interest and in terms of what we have achieved, because what had happened, as I said, is that an application had been launched, and we launched our investigation whilst the application has been considered. So that means, therefore, the process of the second patent had not really started yet. And so as those competitors now can be able to get in and play in the field and also sell the drug, the generic drugs, to the Department of Health.
No, absolutely. It's a huge breakthrough, particularly in a country where TB is still a leading cause of death here in South Africa. Fatima Hassan, is it good enough to just stop the investigation once Johnson & Johnson had agreed to these terms? Or surely, should there be some sanction for this highly inflated price that they've been charging for who knows how long?
Thanks. So I think we just take a step back. I think we have to recognize that this is a really momentous outcome to the initiation of the investigation by Johnson & Johnson. And it comes off the back of a lot of work that has been done by TB patients and activist groups around the world who have successfully challenged the secondary patent of Johnson & Johnson on this very important drug, Bedaquiline. And so what Johnson & Johnson tried to do in South Africa was to also get a second patent application using South Africa's very lax, in our view, patent regime and overcharge on the price.
Yeah.
And what the investigation did was actually force Johnson & Johnson into a corner. It not only agreed to drop the price significantly, so it shows that we have been overpaying on this key TB medicine, but it also agreed that it would drop its patent. And that is significant because it's the first time where the Competition Commission has really recognized the very pernicious role that over-patenting plays in South Africa for access to essential medicines. And that's what the investigation was focused on.
Yeah.
In its press statement, and Sipho can speak to it, it says that it's now going to focus on other companies that are using South Africa's very lax patent regime and patent laws, because our government hasn't changed these apartheid-era laws, to also pursue investigations against those companies, whether it's for HIV or cancer, etc. So going to, I think, your question, we have to recognize that it's significant that J&J decided, because of this investigation in South Africa, that it would not enforce that patent in 134 low-middle-income countries. So this investigation hasn't just benefited South Africa, but it's benefiting TB prevalent countries where there's a high epidemic or co-epidemic with HIV, and it's benefiting those countries as well to benefit from generic competition. Would we as NGOs like to have seen J&J slapped with a huge penalty? Of course. But I think we take the victory that is before us, and I think it's an important signal, not just to J&J, but also to other companies that are following similar practices.
Yeah, I mean, absolutely. There's no overstating just what a victory this is, Fatima. I absolutely agree with you. And the Competition Commission, Sipho, no doubt sees it that way as well. So in terms of next steps, it seems like we need to closely focus on our patent laws in the country. That's really where our next focus should be.
Undoubtedly, Michelle. You must remember the price now that they were able to negotiate and go down to is the price that they have been selling the drug to Global Drug Facility, which is a global procurer. However, I think what we value and appreciate as the Commission as well is to work with stakeholders who are able to bring our attention to many of these areas. I think working with our stakeholders in health, working with everyone who's able to give us information, because now, as we have said in the statement, as Fatima has also said, we are going to focus on these secondary applications. Of course, the application process is a process, so it means that we must bring in our colleagues in the other entities so that we are able to monitor this. At the end of the day, it is a South African poor, it is the consumer, it is the patients who are suffering. And working together, we're able now to expose these things and to register there's a landmark victory like the one that we have registered now, to make sure that our patients, our customers are getting the best deal in the market. And we'll continue to do so, and we'll focus on this market just to make sure that this stops and it's not happening anywhere else.
Yeah. Fatima, I mean, the numbers in South Africa insofar as TB deaths are concerned, 2022 numbers, upwards of 54,000 people in South Africa died of TB. This obviously opens up the market now, right? And in terms of just access and affordability for this life-saving medication, I'd love to see, a year down the line, what impact this has on our TB numbers and our TB deaths.
Yeah, definitely. And remember that there are other TB drugs that we also need affordable access to and timely access to. Bedaquiline is not the only one. It's one of the key ones. And so I think this is the opening of many more investigations into TB drugs that are used in South Africa's national treatment regimen. And, Michelle, when you talked earlier about should there be a penalty, I mean, certainly our concern is this is the same company that we've exposed was acting as a bully by demanding really onerous terms and conditions of the South African government during the COVID pandemic. It is the same company that has overcharged us for TB drugs when they could have offered us a lower price so that we could have got the same price as what Sipho referred to as the GDF facility. So there's something fundamentally wrong with our system for medicine access in South Africa. And if we're going to allow companies like this to over-patent, to overprice on key essential medicines, then there's really no hope for an affordable, well-funded, accessible medicine access system under national health insurance. We really have to call on the Minister of Trade and Industry. We have a new minister now to give effect to the long-standing reforms that are required for South Africa to catch up with other developing countries, because otherwise we're going to get many of these multinational foreign pharmaceutical companies continuing to do what J&J did with this very important TB drug, and that is to over-patent, or to what we call seek evergreening patents. If you have a system that is so permissive to the multinational industry and these companies, then we continuously as civil society with regulatory bodies are going to have to try and fix a system, and that's not sustainable. We can't do this for every single drug, for every single illness. And so it's really, I think, time for South Africa to have a conversation about why can't we amend our patent laws that we inherited from the apartheid regime.
Yeah. And I mean, Fatima, the question is, how many lives could have been saved? The COVID-19 example that you use for Johnson & Johnson and its vaccine at the time, and the overcharging that we now know took place during the height of the pandemic, that's a great perspective on what is a moral question, right? Is it too much to expect from these pharmaceutical giants to lean into what is a moral imperative?
I don't think I've ever seen a pharmaceutical company acting on a moral or ethical basis. All of our work of the last 25 years shows that they act with a profit motive in mind. And that's certainly what has happened in this case of Bedaquiline. So I think that the fact that we as civil society in South Africa could not oppose this patent before it was granted, while our activist friends and lawyer friends in India and Brazil could do the same successfully, I might add, I think suggests that there's a systemic problem. And companies like Johnson & Johnson and other companies are taking advantage of the fact that we have a very lax patent regime in South Africa. And it's only until the Competition Commission stepped in, initiated this groundbreaking investigation, where J&J, within weeks of that announcement of that investigation, announced two things: that they would dramatically drop the price, and more importantly, that they would drop the patent in 134 low and middle income countries, not just in South Africa. And I think that suggests to us that there's clearly a problem with the system, and we need to make sure that the amendments and the revisions to it to make it more pro-access to medicines, more in line with our constitution, needs to be fast-tracked now. We can't understand why Minister Patel, the predecessor to Minister Tao, did not take forward this reform from 2018, but certainly the time is now, because I think we are wasting too much money of the public fiscus on overpaying for medicines that we should be paying less for.
Absolutely. So your next stop, Sipho Ngwema, is no doubt the Department of Trade and Industry. Fatima talks about a lax patent regime in South Africa. I mean, goodness knows how many lives have been lost since COVID-19 and well before that, insofar as our patent regime is concerned. But what kind of communication does the Competition Commission now have with DTIC?
Once again, thanks, Michelle. What we need to do now, and in fact, in terms of going forward, is to strengthen, one, our relationship with stakeholders like Health Justice Initiative and others in this area, but also with our colleagues. Remember, we are also an outfit of the Department of Trade and Industry, and therefore we need to make sure that we strengthen that relationship and look at the issues that have arisen and how can we stop them, particularly in our areas of competition, just to make sure that competition is not distorted and the consumer is not adversely affected by some of the decisions that are not taken in this particular space. So the next step, as I said, is to advocate for stakeholder management and just to make sure that we tighten those up in order for us to look at the loopholes and some of the weaknesses that we have in the system that allow this kind of things to happen.
To both of our guests, thanks very much indeed for joining us. An incredibly important story. The head of the Competition Commission, Sipho Ngwema, and of course Fatima Hassan is the founder of the Health Justice Initiative in South Africa. The Commission saying that Johnson & Johnson and its subsidiary Janssen has agreed not to enforce their Bedaquiline patent, not only in South Africa, but also in 134 other middle-income countries.